Erectile dysfunction, or ED, is a common medical condition affect men. It's defined as an inability to sustain or maintain erectile function for intercourse. So ED is a common condition. It's estimated that about 40% of men over the age of 40 suffer from erectile dysfunction. ED can be caused by various conditions affecting men's ability to achieve erections. It could be due to vascular problem, a hormonal problem, or even a neurologic problem. ED is often diagnosed by self-examination or self-awareness of this problem. For those patients who come to clinic, often we do a thorough history-taking, physical examination, as well as doing an evaluation including blood work as well as some imaging testing. ED can be prevented by leading a healthy lifestyle, regular exercise, controlling the underlying metabolic problem that can lead to ED, such as diabetes or hypertension. For men with a severe form of ED, there are a number of options that can be treated for and to obtain normal erections. The benefit of seeing a specialist for ED is that a specialist oftentimes is aware or at the cutting edge of the science in ED, providing the best evaluation, treatment options that are available nowadays. That ultimately will make the patient feel at ease and feel that he is given the best cutting-edge treatment in this field. Typically, a patient with ED, by counseling patient, educating about what the causes are, if they are having obesity or diabetes or having heart problems, we often refer them to medical doctors who can treat the underlying metabolic or even cardiac problem. Ultimately, patients who need a more directed treatment for ED, we start with pills that can help them improve the blood flow to the penile region and getting better, harder erections. From there, we have other forms of medical therapy, including injectable medications. There are also vacuum erection devices that can be helpful in this situation. Ultimately, for patients who really having what we call medically refractory ED, we often offer penile implant as a definite way of treating their erections for once and more definitely. Having a thorough evaluation specific to the patient needs and his partner's needs, I think is very essential. I think discussing all the options with the patient and his partner about what's available for ED. And typically at the end of the consultation with the doctor, the specialist doctor, I think you can reach a more tailored approach to kind of meet the patient condition. And the idea here is to improve the patient outcomes at the end of the day. Typically, patients with ED, we start them with pills, as I mentioned, or even injections. However, these medications we know sometimes are not as effective as we hope to see. We offer other forms of therapy like vacuum pumps that also has its benefits and drawbacks. Ultimately, patients, again, with severe ED, we try to discuss with them some advanced testing that establish their blood flow to the penile area and evaluate them for any possible vascular problems or other advanced problems. Having ED in men is really an indicator for underlying medical problems. If you have an ED, that really needs to be looked at by a specialist. So that could be a harbinger for underlying metabolic cardiac problems. So I think leaving the ED untreated or unaddressed, that can lead to really bigger problems. I think nowadays we have a lot of options for ED, and I think most men will get really satisfied with the treatment options. But more importantly is to uncover underlying medical conditions can be really harmful for overall men's health. One of the biggest problems I see in patients who have severe form of ED is that lack of blood flow, and that oftentimes manifests as a shortening of penile length, as well as Peyronie disease that can be developed in the long run. The reason for those conditions to occur is that there are not enough blood flow that allow the penis to function as normal. So shortening could develop, and also Peyronie can also develop, which is a curvature in the penile area, which can be really difficult to manage in the long run.